Circumcision is done in males. There's foreskin, it's extra skin at the tip of the penis, and it's surgical removal of that skin. A lot of different reasons. Some religions, that's part of their religious customs, but I'd say in this country probably mostly it's a cultural thing, cultural norm. Most boys are circumcised, and some are afraid of the procedure, and also dad maybe wasn't circumcised, and so the child doesn't end up getting circumcised. Culturally too, a lot of the Hispanic families that we see here do not get circumcised. Medically speaking, there is a lower rate of urinary tract infections in males that are circumcised. There's also a lower rate of penile cancer in males that are circumcised. One other benefit of circumcision could definitely be that it's easier to care for. You don't have to pull back the skin and remove the material that gets under the foreskin. The risks of going through the procedure are pretty much just like most surgical procedures, are bleeding and infection. Before doing the circumcision, we always make sure that there's no family history of bleeding disorders, because that would definitely be a risk of significant bleeding in a child that could potentially have hemophilia. Pediatricians will use lidocaine and do a nerve block to the penis, and that relieves some of the pain. A lot of the discomfort during the procedure is a child is strapped on a board, is naked, and just fussy from that. And there's definitely parts of the procedure where you can tell they feel the pain, but the numbing medicine will last and give some analgesia after the procedure. Typically, it gets done while the child's in the hospital. But if a child's real small, or the parents are on the fence, or there's just different various reasons, but most of the time it's done before they leave the hospital. If it's not done shortly after birth, the child may even have to wait till a year to get it done. The urologist usually will wait till about a year to do the procedure. And the child would likely need to be put under general anesthesia for the procedure, because it's a much more complicated procedure at that point.